Welcome to the Healing Pain Podcast with Dr. Joe Tatta. Each week, we interview top experts in physical therapy, pain science, and integrative pain care. You'll learn the most up-to-date information for treating and reversing persistent pain. This podcast is for educational purposes only and not intended to be used as personalized medical advice. And now, here's your host, Dr. Joe Tatta.
Hey there, friend. Welcome back to this week's episode of the Healing Pain Podcast. We're going to do something a little bit different this week than I typically do. Typically, I'm interviewing a guest or an expert about a piece of research that they conducted, an investigation, or maybe a clinician who's doing some interesting work or wrote a book. But this week, what I'd like to do is I'd like to share with you or give you a sneak peek look into our monthly coaching and mentorship calls, or we call them our community coaching calls. But essentially, they are mentorship and coaching calls that center around the courses and learning activities here at the Integrative Pain Science Institute. But before we do that, I want to thank everyone who showed up to San Antonio, Texas for the 2022 Combined Sections meeting for the APTA. And I want to thank, of course, the APTA, the American Physical Therapy Association, for inviting me to speak and some of my other colleagues here at the Institute, where we had an opportunity to present 5 sessions on lots of different topics related to chronic pain, physical therapy, and of course, the promotion of health and well-being for the patients we see. I had a great time. You know, San Antonio is such a great city. If you've ever been there, great walkable city. They have that river walk. It's kind of like this little rolling river that runs through the center of the city. And they have all these like kind of restaurants and bars that line that river walk. I didn't have too much time to hang out at the bars and restaurants, but I did have an evening where I connected with one of our instructors here at the Institute, whose name is Jeremy Fletcher, and we chatted lots about PT and really where we should go as a profession. And I also had the opportunity to connect with Carrie Rothschild, who is here at the Institute as well, who teaches our pain education course. And I want to congratulate her because Carrie was awarded the Academy of Orthopedic Physical Therapy James A. Gould Excellence in Teaching Award, specifically for teaching orthopedic physical therapy. She's a professor at the University of Central Florida. So I got to attend her award ceremony, I was super excited for her. I met some of the students who are going to school at the University of Central Florida. They're in their DPT program. So I want to give them a big shout out, say hello, and super excited for all of you moving into a wonderful profession of physical therapy. But, you know, the overall theme of the conference this year, so the last time I was at CSM was before COVID, which I guess was probably back in 2019. There was a big conference that year in Colorado, in Denver. It was I believe about 17,000 people. This year, I believe CSM was a little bit smaller, maybe around about 11,000 or so. But I noticed that the overall theme of our conference has changed over the years, where it used to be kind of very focused on joint structure and function, if you will, which of course is important. But there's really a progressive movement that's happening in physical therapy where they're embracing the biopsychosocial model, not just for chronic pain, but for many different types of chronic health conditions, acute health conditions, and really through all the different specialties that we have as physical therapists and other licensed health professionals. When I was there, I had the opportunity to interact with a lot of DPT students because they attended a lot of the lectures that I was giving on various topics like nutrition and acceptance and commitment therapy. And quite often they'd ask me, you know, about the courses, but they'd ask me, do you offer any type of mentorship at the Institute? So for when they graduated, what opportunities are there to interact with me? And of course, the wonderful staff we have here at the Integrative Pain Science Institute. So this week, I want to share a sneak peek with you into one of our Institute monthly mentorship and coaching calls. We hold these calls once a month on a Saturday. They're typically about 90 minutes long. It's a Zoom call, live Zoom call. And of course, it's an opportunity for people to ask questions, but more importantly, we usually focus on a clinical case, or we practice some type of new technique or biopsychosocial skill that requires more of an experiential approach where we have to practice and kind of reflect on what we've done. And then we also invite the Institute faculty to come and talk to our course participants, share what they're doing with regard to projects and research. And oftentimes they're teaching different types of skills related to the course that they teach here at the Institute. So this week, I want to share with you the monthly mentorship and coaching call we did with Dr. Annette Willgens, where we discussed mindfulness. She teaches the mindfulness-based stress reduction course here at the Institute, and talk about mindfulness and how you can use it, and obviously its various implications. So one of the other reasons why I want to share this with you is because mentorship is one of the things that really changed my life and my career as a physical therapist. So early on, when I first graduated school in 1997, one of my earliest mentors was the director of physical therapy at the inpatient rehab I used to work at. Her name was Pam, wonderful PT, who kind of took me under her wings right out of school. Then I had more advanced clinical mentors. There used to be a physical therapist. His name was Jeffrey Ellis, the late Jeffrey Ellis. Unfortunately, he passed. He was a wonderful manual therapist who had all these courses developed around really orthopedic manual physical therapy. And I took about 4 or 5 courses with him my first couple of years out of school. So he was like an advanced clinical mentor of mine. Then I've had business mentors. I've had personal mentors. Sometimes they're friends or colleagues, but oftentimes they're people that obviously, I'm paying them for services to mentor me around, okay, I have these business ideas or goals. What do I do? How do I put this in motion? They hold you accountable. They set you with strategic planning. So if you want to build out a business and things like that, I've even had a spiritual mentor. So there's a particular individual I work with who has a PhD in psychology and divinity from Yale University. And I started working with him probably about 5 years ago because I realized the chronic pain space, there's a big spiritual component to chronic pain. And there's something there that we should all start to explore, both how we help our patients and what is the deeper meaning for me as a practitioner, as a founder of an institute now. So he's been great to kind of talk to the deeper work sometimes that we have to do. But today I want to share with you Dr. Annette Willgens. She's going to talk about mindfulness. I'm on the call with her. We're co-facilitating this call, and she'll guide you through a couple of different exercises. And then, of course, you're going to hear interaction between the participants who are part of this mentorship call. They're all people who have signed up for various courses here at the Institute, whether it's our nutrition course or motivational interviewing or ACT or trauma-informed pain care or pain education. Everyone is kind of in this group, going through all these courses and learning. Which we talk about self-report measures you can use with regard to your initial evaluation. And then what happens when you get stuck as a practitioner, right? What happens when you get stuck and your patient's not progressing? So it's really, how do you start to integrate all this together in a seamless way for your practice? So I hope you enjoy this week's call. It's about an hour. There is some experiential exercises because it's a mindfulness call. So if you're driving in the car, or you're walking on the treadmill, you may want to pull over to the side and, take the opportunity to experience the exercise. And that is really great with delivering mindfulness. And of course, there's going to be lots of Q&A. If you have any questions about anything we do here at the Institute, any of the courses that we have, or any of the sessions that I presented at Combined Sections meeting or our mentorship and coaching calls, just send us an email. Email is really easy. It's support@integrativepainscienceinstitute.com. That's support@integrativepainscienceinstitute.com. Okay, without further ado, let's begin. You can listen in on a sample monthly mentorship and coaching call that I delivered with Professor Annette Willgens. All right, enjoy. Hope you're doing well, and I'll see you soon. Hi, Annette. Welcome. We're super excited to have you here today.
Hello. Thank you so much. I wanted to begin by saying welcome. And I'm having a little struggle today with a little cold. So I'm just a little bit under the weather. So if you're hearing this nasally kind of crackly voice with occasional coughing and sneezing, yes, it is me. So I apologize in advance. It's so good to be here. Thank you so much for having me. I'd like to know, if you wouldn't mind entering into the chat box, how you're doing today. So on a scale of 1 to 10, 1 meaning you'd rather go back to bed and pull the covers over your head and not come out for a very long time. And 10 means you are actively engaged in whatever is coming your way and feeling fully capable of addressing it. So on a scale of 1 to 10, how are you? So some 8s, 7s, 8s, 10s. Wow, a 6, a couple more 8s, another 6. Okay, All right. Yeah. 5. I get it. Yeah. I'm at about a 5 myself. 7. All right. Good to know. Good to know. And with that wisdom, with that knowledge, let's move forward into this next hour. So I'm Annette. I'd like to begin with a brief meditation. So wherever you are, feel free to unmute yourself. Mute yourself, and feel free to turn off your video if that's easier for you to kind of feel like you are grounded and having a little bit of privacy. And I'm going to talk you through a brief meditation. So I invite you to blink your eyes closed. I'm going to be here doing the very same thing with you. So we begin, blink the eyes closed, or if that's not preferable, then just a downward gaze. And begin to tune into the fact that you are here and you are breathing. Perhaps feeling the breath coming in at the tip of your nose, the coolness of the air entering the nostrils. Perhaps tracing it down your throat. Perhaps you feel the breath more at your chest. If I'm feeling extremely distracted, I like to put my hand right on my chest and then another hand on my belly just for a really physical presencing of my breath. Nothing to change, nothing to do. Simply noticing air coming in and air coming out. I invite you as you breathe to scan your body. So uncross your legs, plant your feet wherever they are, tall spine, and begin at the base of your toes. Really lift your toes up, spread them out. I'm hoping your toes are in some yummy slippers or maybe even without socks. Wherever they are, spread them out, make space, wiggle them, and place them down. Notice the ball of the foot and the arch. Notice the center point of each heel bone. Notice the calf, the front of the shin, the felt sense of the knees. Notice the density of the long bones of the legs, the weight, maybe any feeling of coolness or warmness. The inside of the thigh, the outside, the front, the back. Notice the sit bones. Get heavy into the sit bones. Allow the pelvis to really melt into the support surface. Notice the low back, the thoracic spine, and then trace all the way up to the base of the occiput. Soften the jaw. Soften the space behind your eyes. Allow the belly to be soft. Notice the space of the shoulders. It's okay to wiggle and maybe rotate them a little bit, inviting them to just soften, get a little heavy, a little dense. And then scanning down the space of the elbows, the forearms. And then the hands. And notice where you've chosen to place your hands. Palms down is more of a grounding posture. Palms up is more of a receiving posture. But notice the space of the palm, wherever it's landed. And then come back to this inhale and this exhale. If you are new to meditation, know that the thinking brain is absolutely normal, very typical. I've enjoyed learning meditation myself and most enjoy kind of encapsulating thoughts in clouds and watching them kind of float away. So you might just label things that come into your brain space: thinking, planning, worrying. And the cloud takes a hold of it and it floats on by. And you return kindly, gently to this inhale and this exhale. Noticing any sound, the felt sense of the body, the life of the mind, always returning to the anchor of the breath. You notice where the mind wants to go. We gently, kindly, compassionately draw it back to the present moment. The moment is right here, right now. The only moment we have any control over. Breathing in, I know I am breathing in. Breathing out, I know I am breathing out. And again, scanning the body from the tips of the toes, feet, lower legs, the upper legs, the weight of the seat, the length of the spine, felt sense of the front body hugging the back body, the space of the shoulders, arms, hands. Unhinge the jaw, soften the forehead. Nothing to do. I'd like to share just one study that's new, that just recently came out in the Journal of Medical and Biological Engineering. And I am not really into medical and biological engineering, but this study really caught my eye. 2021 study by Moraes. And essentially what they did in this study was looked at the effects of mindfulness meditation training and electrophysiological signals recorded during a concentration task. So we talk about like how easily we are distracted these days. And what these researchers did is they looked at depression, anxiety, but that there is a good deal of research out there to support what we're doing, why we're doing it, and how it can have lasting effects on the physiological state of the body. So at this time, I'm happy to take questions, comments, anything anyone would like to share. Any questions at all? What courses are you taking? How are they resonating with you? What's new in your practice? Where are you in your practice?
I'm in a little different situation. So I'm retired, but wanting to, I've been just discussing doing some mindfulness, classes and some other things with neuroop.
I strongly encourage you to continue whatever journey you're on toward either a mindfulness certification, that's sort of psychologically informed certification that Joe is talking about. There's so many different avenues out there, but I think my suggestion for you is to cultivate your own practice. And that can be challenging and exciting. I tend to do it the last thing before I go to sleep every night. I sit up in bed, I do my meditation, I prepare my body for sleep. I'm not a good sleeper. I tend toward anxiety. I tend toward, not enoughness. And so my mind starts to go a bit crazy when I go to lay down and try to sleep. So that's the time that I found is best for me. So choose that time, commit to that practice, and then just keep noticing, keep being aware. Did I address your question, Ellen?
Yes, just your encouragement is great. I've been a long time meditator, and I think any group would be appropriate, even outside of a medical setting.
Yes, absolutely.
And it's been a lifesaver for me.
Yes, agree. Me
Yeah.
too.
Thank
Me
you.
too. Of course. I think the most important thing that we can do for our patients and for the people that we have direct connections with as we share this practice is to ask people, what is your story? And by that, I mean, what is the story that you tell yourself on a regular basis? And so I just shared a little bit of my story. And I always, when I do this work with my Doctorate of Physical Therapy students, I always start with, this is my story. I'm a kid of an immigrant parents that put a lot of pressure on us, loved us to death, but there's this constant feeling of not enoughness, unworthiness, and that there's this constant striving, and it can get a little bit ugly, and it can get a little bit graspy, if you know what I mean. And so I have to really continually rein it in. I can be very competitive. I have to notice that. And I have to continually check in about intention. So enter into the chat box. What's your story? What's the story that you tell yourself? Is there a story that informs who you are? It takes a moment to check in on that. Thanks, Anne. Yeah, like this feeling that it's never good enough. A helper. Yeah, a people pleaser. Does that resonate with you, Mary? Everybody else comes first, me last. Yes, that's Joe. Yeah. Take care of everyone. Yes. A recovering perfectionist. I love that. Yes. There is no such thing as perfection. There just isn't. And I would say that perfectionism is always maladaptive. Yeah, putting others before yourself. Yeah, absolutely. All of the above. Well said, Ron. Ditto. Love it. Yeah, so when we know our story, right, when we know the default mode of the brain, we can catch ourselves much more easily. And that happens pretty nicely in meditation. I frequently find myself going to, I should, I need to, I have to. And if you notice, all of those things come from a core place of I. So it's all about me all of the time. It's very self-centered, very self-focused. And when I step away from that, that's where I can find space. That's where I can find that shift that needs to happen, so that kind of like peeling away the layers of the onion, I can find the core of what's really going on in the present moment. Betsy asks a great question. Do you think our stories change as we deeply healthcares, as we heal through healthcare? I think that our stories do change. Absolutely. I think as we grow and mature and end the cycle of that, of the maladaptive patterns that no longer serve us in our youth, absolutely. And I think that the more we meditate, the more we do the work, the hard work to uncover that truth, I think that that's the key to shifting that story. Absolutely. One of my favorite authors, Dr. Hawkins, out of University of Michigan, he says that we like the small part of ourselves. The thoughts are still there. Absolutely, Mandy. But Dr. Hawkins says there's this small part of ourselves, like the small s, that's attached. It's very familiar, no matter how painful or inefficient or maladaptive it is. The small self enjoys this kind of negativity and this kind of, impoverished life that goes with it, feeling unworthy, invalidated, judging others, judging ourselves, being inflated, winning, being right, grieving the past, fearing the future. I mean, you know what this sounds like in all of our patients and sometimes ourselves, craving assurances, wanting certainty, all of those things. But are we willing to imagine a big S self? Are we willing to really show up and be really truthful so that we can find joy and love and inspiration and feeling okay with exactly the way things are in the present moment? Mary has a question.
Yep. Hello.
Hi, Mary.
I work in Delaware. I work at a prison. And I do these all the time. I've been through the ACT course and the mindfulness course, but every once in a while, I come upon someone who is just so resistant to any kind, like they've spent their life running away from who they are and from every feeling and from, always making up this story about themselves and trying to be that. And I was just wondering if you have, for those particularly really hard-shelled patients, if you have any tips for getting in.
Yeah, that's a great question. And what a service of love that you are doing. The word dissociation, does that mean something to you?
Mm-hmm.
So we dissociate all the time. I did it last night when I was worried about not being able to sleep, and this talk this morning. Is anybody going to come? And am I really relevant? And does any of this matter anyway? And who do I think I am? And all of that is my story, and sort of that self-doubt that sits on this shoulder on a regular basis. So I dissociate. I go to Amazon and I think I need a pair of boots. I don't need a pair of boots, but that's my way of dissociating, and it works. So if you can call out that individual, it's really easy to make excuses and dissociate and share your story. I challenge you to not do it. I challenge you to sit with it and to really call them out on that dissociation. Now, sometimes dissociation is helpful. Sometimes it's necessary, but more often than not, when we dissociate, it's about that familiar. It's the small self. And if that familiar is what you're attached to, it's going to be really hard to come face to face with the truth. And the truth is that there's more right with you than wrong with you. John Kabat-Zinn, right? And that we need to take a fundamentally non-contentious attitude toward whatever we are experiencing in the present moment, and name it, call it out, label it. When we see it, we label it. It stops being this subjective thing that takes over our sympathetic nervous system, and it becomes this more objective thing that we can see. And not only that, we can see it among others. So I'm happy to share my story because I know you all have a very similar story. Like, who in this room doesn't have self-doubt that follows them around on a regular basis? There's certainly different degrees and there's different origins of it, but we are all more alike than different. And that individual wants to stay different. It's serving him some purpose. So I would ask him, what is it serving you? What is the purpose of you continuing to be different and continuing to tune into your small self? What do you think?
It's hard because they have these patterns that are just so ingrained.
Yeah.
And the people that are the hardest don't want to share.
Yeah.
So it's really hard to get them to even tell you their story. And then there's this huge mistrust of anyone that's trying to give them care, but then they blame everyone for not getting the care that they need.
Exactly.
So
yeah.
There's lots of layers.
I think the worst thing that we do is that we hide. And you might even start a conversation with that statement. And hiding is shame. And shame is the most destructive of all emotions. I used to think it was fear, but now I've decided it's shame, because shame doesn't even allow somebody to talk about fear.
Yeah.
Right. So you might just talk about what shame feels like in the body, where it lives, and the effect it has physiologically on inflammation and blood vessels, and right down to the cellular level. And if you truly want to change your life, looking at the place that shame lives is a good start. And it's scary and it sucks and it's hard, but it's the only way through. The only way out of anything is through, right through the middle. And I know I probably have not, answered your question completely. And I know it's not that easy, but addressing things like shame, fear, and that dissociation and that wanting to be with the familiar, it's why women choose men who harm them, right? Because it's familiar and they're unaware. I don't know. What do you think?
Yeah, I mean that all rings true. It's just sometimes really difficult to, when you start to ask them to look in, they just won't do it.
Yeah.
But they won't accept any labels from you either. So
what kind of labels do you offer?
Well, I'm going back to what you were saying before, if you could look at your fear, if you could look at your shame. I am not afraid of anything, and there is nothing that I'm ashamed of. So.
All right. Well, then, if there's no shame and there's no fear, what is there?
Everything is someone else's fault.
Ah, I see. There's blame.
Blame, lots of blame.
So blame is grief.
Yeah.
And so maybe to talk about grief is a good place to begin.
Okay.
Absolutely.
Actually, that sounds good.
What is grief? What does it feel like? What does it look like? What does it smell like? What is its color? Where does it live in your body? And the grief of what's been done to you. That's very much a trauma-informed care perspective.
Yeah.
Yeah. Thanks for working that out with me, Mary.
Yeah, that was good. Yeah.
I have a question.
Yes. Hi, Anne.
My name's actually Annette, but I thought that would be really confusing.
Oh, funny. There's another Annette.
I know, never, right? It's very rare. So I work with veterans. I've worked in the VA system for 23 years now.
Wow.
And I love it, but it's extremely, extremely challenging. I work mainly with chronic pain patients, and I actually have a program called Pain University, which was developed out in Toma initially, but I brought it to our facility and it was going really well until COVID hit. And then, you all know how that is. But I'm getting it back up and running, and it actually drew me to meditation because I was telling my patients, oh, meditation, that's a really great thing. And I wasn't doing it myself. So I did the whole, I'm going to do it for a month. I'm going to do it for, 15 minutes twice a day. And I did it. And it was amazing. I mean, my kids saw a difference. I could take that pause, that breath, that, and not feel like I'm going a million zillion directions at once. So thank you for getting me back into it, because taking this class kind of got me back, into
Yay.
that. Yeah,
good.
So during Christmas, we really need this. Oh my gosh.
I know.
So I guess I had a couple specific questions. Obviously, in the VA, we deal with tons of chronic pain. We deal with PTSD, anxiety, the whole blame thing that you just talked about. I feel like so many veterans blame the VA, the military for their problems. They feel like they're broken, and they have a mistrust a lot of times with the system, because the system hasn't always been great, especially because we tend to work in that biomedical model. They've had the injections, they've had the surgeries, they've had the medication, and none of it's worked for them. Right. And now here I am trying to bring on these other things, and there's a distrust. And part of it too is they're afraid of getting better. Does that make any sense?
Oh, yes. The familiar, right?
Oh my God.
Yes. To break away from that is terrifying.
Yeah. So on Wednesday, I actually had a veteran who, she kind of lost it, when I even suggested the possibility that she could improve upon her pain. She pretty much said, I'm out of here. You don't know what you're talking about. You're all the same. And she left and went to patient advocate and complained about me and said that I was threatening her. So there you go. That's a good one. Talk about self-doubt after that. Woo! That was a tough one. Yeah. So, as far as specific questions go, like, as far as bringing meditation in, I've heard that sometimes with PTSD, certain meditation can be not the right one to do. And I was just wondering, like, which one may be better for PTSD versus chronic pain. I'm not sure if a body scan is good for chronic pain, because then do they focus on their pain? Just any sort of guidance into that, although most chronic pain and PTSD is right together. So I guess
Annette, before you answer, Annette, can I just hop in on one comment that Anne made?
Of course, please do.
Welcome, Anne. I love the work that you're doing. I'd love to hear more about it. I think, for us as clinicians, we oftentimes look at the VA as a place where innovation can happen. And we'd love to have a little bit more of that in the private sector, which we don't. So I welcome your input. I don't know if you have done the ACT course or not, but in general, in ACT, when we approach people, we don't approach people as pain being the one thing that we're after. So when that patient you have said, well, you're not going to alleviate my pain, you're full of beeswax, I'm just out of here. It's really interesting to think of it from her perspective, because we don't know her history. We don't know her diagnosis. She may, in fact, and some people do, live with pain their entire life. As professionals, I think we have to get better at saying, I'm going to help support your life as best as possible in all the different various ways. And that's part of like an integrative approach to pain. There is, for some people, when you do approach them with the idea of pain relief, there is a wall that goes up. And that wall goes up for a couple of reasons. One is they've tried things before and they've failed, right? And they've lost trust in the system. As you mentioned, our system is one that causes pain and trauma to persist in many ways. So it is weird because all of us are a part of a system that is causing this to persist. But we're also, as Annette is working from the inside, trying to change that system. So I think saying to someone, I agree with you 100% that this system is broken. I'm working from the inside, taking the steps to change that system. And you and I are part of that change. And then with regard to pain relief, the reason why it might scare some people away is because they don't want to be let down again. It hurts to be let down again when they enter in with all their energy of their mind and their body, and it doesn't work, so to speak. So pain relief for me is always the last aspect of things. Yes, I'm talking about pain, like we're not going to ignore the elephant in the room, but what else can we improve upon? How can we improve upon your stress? How can we improve upon sleep? How can we help you manage your thoughts and emotions better? And when we kind of work around the outside of that, if pain is in the middle, the center, right? If we work along the outside of that, eventually pain will get better. But yeah, hanging the shingle of pain relief, so to speak, can be quite challenging for us as individuals and the system in general.
I like that. That's really helpful. And one of her things that she also mentioned was, you'll take my disability away if I get better. So that was part of it too. But I love that, going from the outside in. That's a great approach. Thank you.
Yeah, that's really very wise. Thanks, Joe. As the mindfulness faculty member on staff, everybody sees me as like, I'm the weirdo. And the students see me as this, I'm the person that they can come to. So my office becomes this revolving door of, nobody knows this, but I have an eating disorder. Nobody knows this, but I have anxiety. I have depression. My parents just split up. My boyfriend of 8 years just walked out on me. All these things that these young 20-somethings have. And I think, who was it? Mandy said it, that there's a lot of mistrust, and it's not just in the VA, it's everyone. I think we all have our armor on. And there's a few things that come to mind just to kind of close the loop here, Annette. And one is asking people if they would like to come from a position of strength or a position of weakness. And that we have to make that choice on a daily basis, multiple times a day. And it can be something like deciding to leave an unhealthy relationship, or whether or not you want to grab the ice cream in the freezer at that moment in time. I mean, and those are both real, right? And when you come from a place of strength, you can't be wrong. When you come from a place of weakness, there's a lot of emotionality involved in that. I'd like, Joe's input in this. And I basically, tell people, my students, you will with intention and consequences, or you will not with intention and consequences. And those are the two ways of being, really. That's
Right.
it. It doesn't have to get much more complex than that.
Right. So less and less, I look at my job to find the deficit in someone, and instead we're on a strength finding mission. So where are the strengths? Where do the strengths lie in someone? And how can we build upon those strengths? And even someone that you might identify as, let's say, having major depression, so to speak, still has some strength there because there's something that is allowing them to even move or be with that major depression. And what is that strength? And then starting to build on that strength instead of, in healthcare, we're just so good at screening and identifying all the problems. And patients see this, right? Patients see this in the self-report measures. They realize, okay, here's a diet questionnaire, they're asking about food. Here's a stress questionnaire or a trauma questionnaire, they're asking about my history. They realize, okay, here are all the things that are wrong in life, but how do we start to move people toward the things that are working for them and start to build that out? I was listening to something just recently. There was a podcast actually about the parents from the Sandy Hook massacre shooting. Just a, heart-wrenching story. And the interviewer was asking them, how do you fill the hole in your heart that is lost now that your child is gone? And they say, I can't fill the hole in my heart, but I can make my heart bigger. And in making my heart bigger, it makes that hole start to close up and become smaller. It may never, ever go away, but as I make my heart bigger, the hole starts to become less. And I thought it was just a beautiful metaphor for just chronic pain and trauma as well, is what can we empower people with? What can we enrich in someone's life? What goodness can we instill that will help fill that gap, so to speak? Because we may never be able to take someone's pain away, and that's okay. But if we can build the other aspects of their life, that's potentially more valuable to their quality of life in the long term.
That's great stuff.
Oh, this is Lisa. I have a lot of patients who are on the autism spectrum. I see adult chronic pain, but I happen to have a number of patients that are on the autism spectrum. And sometimes some of these things are really difficult. So do you have any suggestions? And I know that the autism spectrum is not a homogeneous term, but do you have any suggestions?
Yeah, that's a great question. So in terms of the, neurotypical versus neuroatypical, I think that one of the biggest challenges is for autistic folks to be embodied. They are very much in their heads, and they've never been taught to be in their bodies. So I think for them, that body scan is extremely helpful. I would keep it short. I would keep it interesting, that parts of our body have color. They may have texture. They have different temperatures. And to get them to be very curious, they have weight, there's density, there's coolness, there's all sorts of wonderful ways to get more embodied. There's an OT out there, Kelly Mahler, Mahler, and she does fantastic work. Look her up, and she's got some great resources.
Thank you.
You're welcome.
So Kelly was on my podcast a couple of episodes back. I love Kelly's work.
Oh, wow.
All in the pediatric realm is most of her work.
Yeah.
And she does have great pediatric resources. So check out her website, listen to the episode. We focused on interoception on that podcast episode, mostly interoception, but kind of from a mindfulness aspect. The other thing, I just want to piggyback on what some of the things Annette was talking about just now with body scanning and helping someone open up to things like texture and temperature and density and sensation in the body. If you think back to the practice that Annette led us through when we opened up today, she said, I don't know if she said this, maybe because I knew she was going to do a body scan, but she was leading us through a body scan. However, she would dip in and out of, let's say, using your hands, one hand on the chest, one hand on the belly. So that was super powerful, right? Just touching into the body, right? Then it was notice the density. I think it was notice the density of your thigh bone, I think she said at some point, right? So what I like about what Annette did is she's bringing in all these different aspects of how mindfulness works, both the mind, the mental aspect, the cognitive aspect, as well as the body aspect. As you're new in meditation, as you're new teaching meditation, you may just stick with, okay, session 1, I'm going to teach a body scan. Session 2, I'm going to teach whatever, mindful emotions. And then as you get better, you weave all these skills together, basically. And that's okay too. There's a place for just kind of targeting one thing, and there's definitely a place as you become more skilled to bring them all in together. Even in her, another thing I liked about Annette's meditation, there was the part with the clouds, which if you're a traditional meditator, you identify that as decentering. ACT calls it diffusion. They're very, very similar. They're practically the same. But again, bringing that component in, you saw that come up in the practice today, which was great.
Yeah, I think in terms of our neuroatypical folks, I think that it would be the same for PTSD. That population is going to have a hard time closing their eyes. I encourage that population to take on a child's pose up against a wall. A child's pose is hands and knees. Knees are wide, big toes touch, and kind of like placing the head down onto a mat. And it's a posture of inviting openness in the hips, where a lot of stress and negative energy is stored. And it's a posture of kind of surrender, and you don't have to close your eyes. And if you're up against a wall, then you're not concerned about somebody walking up behind you. And I think those are the key concerns. So some gentle yoga would be really wonderful for any of these populations.
And some of these populations that we're talking about, schizophrenia, PTSD, even chronic pain, it's okay to be brief in the beginning.
Oh, yeah.
1 to 3 minutes with eyes open or just slightly gazing down. When eyes are open, we just gaze down a foot or two in front of us. 1 to 3 minutes is plenty for some people. Mm-hmm. And it's not, yes, it's for the PTSD crowd and for those with psychiatric conditions, but sometimes you'd be surprised it's just for people who've undergone a lot of stress or have a difficult time with meditation.
Yeah.
Meditation is not easy for some people.
It is not. It is not. I don't find it easy at all. I need to do yoga, some pretty intense yoga, to be able to sit and be still at the end of my practice, which is another place that I do it. The other thing that you can do is work with cues while you're inviting people to meditate. One of my favorite cues is notice the end, notice the pause at the end of the exhale. So as you're breathing in, you're breathing out, notice the pause and keep repeating that cue. It keeps people focused on the breath because it gives the mind something to do. So that works early on. The other is alternate nostril breathing. You really have to focus the mind on the changes in air going into one nostril, exiting the other. And I invite people to do this without the hands and then just to sit quietly. Obviously, the air is going into both nostrils, but you're focusing the mind on only one. And so it's interesting in that it does give the mind something to do for those people that have a lot of trouble.
The other thing I'll add to that is remember with any type of meditation technique, there's an open focus and there's more of a centered focus. So the centered focus is the breath. Now, for a lot of people, especially those who are high in the anxiety realm, focusing on the breath can be anxiety provoking for people, especially when someone's tight and they have poor posture and they're already constricted. So Annette mentioned she likes to do yoga first. If you're a PT, you can do some stretches before that. That's okay. The other thing is, if the breath is a place that causes anxiety, then either frequently during the meditation to move outward. So for example, you start focusing on the breath, and Annette did this during her meditation, then focus on a sound, and then come back to the breath, and then focus on your leg, and then come back to the breath. And then do you see any light coming through your eyes if your eyes are closed? So you're moving someone's awareness in and out rather than staying stuck in one place. If someone has a really, really hard time focusing on the breath, then just have them focus on one body part, maybe just their hand or their foot, or whatever body part is comfortable for them. The other thing is that there are different places you can focus on the breath. So for some people, just that spot below your nose and above your lip, where you can feel the air entering and exiting, is a nice place of focus. For other people, it's in their belly. So you have some choices and some areas to play with. If you find people have a hard time, let's say, just staying focused on the belly, which is oftentimes where we start. But again, we have flexibility. We can modify this as we go along.
I have a question, but my dogs are about to go crazy because I think Amazon is here. In the course, you talked about trauma related to the act of breathing. Could you give some examples of that?
You're talking to me or to Joe's trauma course? I'm sorry.
That was actually in your class, yeah.
Oh, okay. So with respect to the breath is naturally a parasympathetic regulator. It's the vagus nerve. It allows the body to calm, especially the out breath. But when there is trauma, the breath, just like Joe said, can be anxiety provoking. So I think the most important thing for survivors of trauma, and you now know about the ACE scores, is to recognize that there needs to be that the space to be able to escape and come back, and to touch away and to touch back in. So if you're guiding a meditation, an open monitoring meditation, it's called, would be much more helpful to a person who's experienced trauma. And I think that another really big deal with the breath is that yoga as a moving meditation can be absolutely critical. So we need to discharge energy that was intended for threat and stress. And the only way to do that is through activity and through the vinyasa, or the series of poses that activate that energy. We can release some of that tension. And then we can practice being still. And then we can practice a more safe relationship with the mind and the body on the breath. Does that make sense?
Yeah, it's so much of a challenge because so many of the patients that I see, just they're so debilitated physically that, some of the poses for yoga you can barely even modify them.
Yeah.
Which is challenging, but I guess moving towards a sitting yoga and that kind of thing would be the way to start anyway.
I just put in the chat thread kind of a framework that I kind of use in my mind, and it appears in Annette's course, it appears in all good mindfulness courses, I would say, is what you're working with is mindfulness of the mind. So that's the ability to notice and observe thoughts in a way that's non-judgmental. Mindfulness of the breath, right? Anchoring to the breath. Mindfulness of the body, that could be a body scan, and then mindfulness of emotion. So those four, you'll see them in very traditional contemplative approaches, but they also show up in even the psychotherapeutic literature around looking at how quote unquote mindfulness works. Mindful walking, mindful movement is the other one that is part of that. So that could be part of mindfulness of the body, but mindful movement is another one that's in there.
Absolutely. So if you can even just get them to do, some folks are in wheelchairs, wheelchair users, to do a push-up is going to activate the co-contraction of the muscles, is going to activate that parasympathetic nervous system, because you are quite literally pushing and using the muscles in a way that helps to activate the system. And then as the release happens, you are releasing some of that excess energy. You know, all of these folks that are the fidgeters or that can't be still. I mean, I'm one of those people. Don't put a pen in my hand because I will break it. I will take the thing off. It drives me crazy, and I'm working hard on that. But I'm a fidgeter, and it's yeah. So people that you see, you can kind of see them right off the bat. Like, okay, that person needs to move before any of this is going to land in their body, and before the mind is going to trust the body. So thinking of it that way, not to overly characterize or categorize. But it's a way to get in without causing more trauma, essentially.
There are also little ways that you can work mindfulness into your session. So, for example, before we start today's session, what's the one emotion that's most present with you today? Or before we begin this exercise that's new for you, is there any emotion that comes up for you? Or are you noticing any emotion present with us in the therapy room as we begin that? Little simple cues to turn people toward their experience. For some reason, mindfulness has this approach that we have to sit, we have to cross our legs, and we have to be there for 40 minutes to an hour. And we, especially in the Institute here, are learning to move away from that. Yes, if you want to develop a course like that and teach that, and that's part of your therapy, that's fine. But just realize that might not be necessary. And it might not be what someone needs to get started, basically. It's kind of like taking a runner and putting them on a marathon first by having them sit for 40 minutes.
Yes.
And even when you start to look at some of the literature, and Annette and I talked a little bit about this in the paper we wrote, some of the most adverse reactions that people have toward mindfulness is the longer 40-minute plus sitting meditation styles. That's when people report oftentimes the most adverse effects. So you hear things like, this re-traumatized me. I disassociated during the meditation process. My pain really became really, really bad during it. And it just tells you that, okay, we have to learn how to dose and grade this like everything else that we do.
Yeah, and the magic kind of happens between the 8 and 15 minute mark. And that's where you start to get the neural changes in terms of gray matter, white matter, telomere length and strength. Is a great article by Tang and colleagues, 2017, that looked at the first article that actually looked at the dosing of mindfulness meditation and what's the minimum? What do I have to do to get some of these really important changes? So that's the current state of the research, is what it's telling us, between 8 and 15 minutes.
So they say begin with the present moment and move forward from there.
Yeah. And
that's really what it's about. Just beginning with whatever is you have here in the present moment and then building on that. Another
great author and researcher, I mean, we all know Jack Kornfield or have heard that name. Tara Brach is another one. She does a lot of great work with STOP. Yeah, Mary knows her. I just love Tara Brach. She has a website, lots of free meditations. The STOP acronym is stop, take a breath, observe, proceed. And then she also does RAIN, which is recognize, accept, investigate, and non-attach. And it's kind of like taking a stop and adding to it a little bit, just for that investigative piece. So not to mean that we need to investigate in great depth, but just kind of, where does this live in my body? How does this show up for me? And that can be very helpful. Very brief, very short practices that are extremely beneficial.
If you notice, most of the meditations that are in Annette's course, the ACT course, the mindfulness-based pain relief course, there's a ton in there. STOP and RAIN are in that course as well. I've made them intentionally brief because I realize for most people coming into our courses, they're working in clinical practice where there are other things we have to do and achieve, so to speak, besides the mindfulness aspect. And brief works really well for our patient populations, typically in the beginning.
Yeah, hi, Joe. This is Ron. I had a question regarding, I'm seeing a lot of people who are Spanish speaking. Is there any resources or things that you can recommend? It doesn't work well with an interpreter. It doesn't seem to. Is there something that I could play that is in their native language that would help?
Oh, I'm sure there are. I don't know
I
of
don't
any
know if you knew any.
I don't have any resources off the top of my head, but I'm sure there are meditations in Spanish. Am I able to lead meditation in Spanish? Yeah, I probably could. Not too many on this call would understand me, but I could, yeah. I mean, my Spanish is pretty fluent. I probably would just do a little bit of brushing up on it before I led that, but yeah, I could.
I would appreciate if you would do a couple, maybe that would be incorporated. I think I'm not the only one who's probably seeing that population.
You're asking me to record them in Spanish?
If that's possible as a part of the course.
Okay, that's a great challenge for me. That way I can practice up on my skills. But I'll tell you, Ron, I'm sure there are resources out there that have better accents and more understandable than what you're going to receive from me.
Ron, I think I found it on YouTube. I had a guy that I had very little English and I had very little Spanish, and I just found one on YouTube. It had nice waves in it. The little bit of Spanish I know, I could tell that they were saying the right things in it. If you do just a little bit of looking on YouTube, it's there. That stuff is out there.
Yeah. So Anne said Insight Timer has a Spanish version. So Insight Timer is a nice place to go for that. That's reliable. And the other thing on that topic is I'm actually working on a presentation for CMS as well on e-health and technology. We're all excited about technology. It should make our lives easier. Just realize before you start directing people toward apps or downloads or whatever it is, make sure that you go through it first on your own. And I don't just mean like play it for 10 seconds. I mean, if you're going to give someone a meditation, listen to the entire meditation. Because if you send someone into an app, and this is the other really interesting part of some of the trauma research around meditation, the two places where trauma responses with meditation happen are with the longer meditations and when people are using apps on their own. I'm not saying an app is a bad place to go. I'm saying, again, we have to dose it correctly and we have to know what the particular meditation is actually teaching. So I recommend play with them, experiment with them, listen to them on your own, and don't just send someone on a deep dive into, let's say, whatever app it is, because as you know, these apps have sometimes hundreds and hundreds of different meditations that might not be appropriate for your particular patient or your particular person you're working with.
That's why I was asking, because I didn't know what the content was. So is it appropriate for the patient? I know it's out there, but I don't know if it's appropriate for the patient.
I'll listen. I think the better thing, Ron, is I'll listen to some in Spanish and
I appreciate it.
I'll link to those. Anyone else? The other thing is just some of the research I've been looking at, which is interesting as well, is that most of the e-health apps that are out there rarely have a clinician on board that are helping them develop the content. So you might wind up with something, and this is not just for meditation apps, there's tons of apps for other things related to pain and health in general, diet and exercise and pain science and all sorts of things. Realize it either might not help the person or potentially there's always potential for harm, right? So you just have to do a little bit of research on your own. So someone's asking a reimbursement related issue. You're asking about reimbursement, Mandy, you're asking about reimbursement and related to meditation specifically. So what I recommend there is that you should be using some type of patient self-report measure that you're providing someone at the initial intake. There are lots of different mindful and acceptance-based self-report measures you can use. They're in the ACT program. They're in the mindfulness programs. We can put some into the Facebook group if you want. But obviously use that for pre and post measures. And then all the questions in those self-report measures become your goals for your short-term and your long-term goals. And that's how it becomes measurable. And what's nice, if you use more than one, then you have more ammunition, so to speak, with regard to documenting and tracking progress and providing information to the insurance company that helps you with reimbursement, obviously, with continued care. Heart rate variability is another one Annette mentioned. So you can use heart math for that and just tracking heart rate variability.
Yeah, I wanted to end with a little poem. I wanted to thank everyone and Again, option to close your eyes or just a gentle downward gaze. But I found this great poem that I just love and I wanted to share it. Thank you so much for joining us today. The poem is Charles Wright, and it is from Black Zodiac. Take a loose rein and a deep seat, John, my father would say to someone starting out on a long journey, meaning take it easy, relax, let what's taking you take you. I think of landscapes, mountains and rivers, lost lakes, where sunsets rise and fall. The scald of summer wheat fields, light licked and poppy smeared. Sunlight surrounds me, and winter birds doodle and peck in the dead grass. I'm emptied, ready to go. Again, I tell myself what I've told myself for years. Listen to John. Do what the clouds do. I wish everyone a wonderful holiday season. And don't hesitate to reach out if there's any questions at all.
Good. And as we wrap up, what I want everyone to do now is to put in the chat thread on that scale of 1 to 10. Let us know where you are now. After doing some of this work today and talking and collaborating, just let us know the difference that you notice.
This is wonderful. This is what, this is the sense of community. This is the Sangha, right?
That's right. And that's why, if you notice, I've even changed some of my language, where I used to call these group coaching calls or group mentorship calls. And now I call them community coaching calls.
Yeah.
Because yes, I can lead, Annette can lead, we can lead, but all of us are leaders at this phase. All of you that are taking these courses at the Institute, you're way, way ahead of so many professionals, not just in the PT world, but even in some of the other health professions as well. So, we want you to be leaders.
Yes.
We're not forcing you to be leaders, but we do think there's that leadership aspect in all of you, where you'll take this work and you'll deliver it to your patients, and you'll inspire your colleagues at work and your friends and your family. Once you start to, move into this realm. So we appreciate you all being here. Again, these are the community coaching calls happen once a month. I'll post the link in the Facebook group, and we also will send it to you via email, so you have it. In general, they're at the same time. They're on a Saturday, usually around 10 or 11, depending on how my schedule works, but same bat place, same bat time, as they say. That's where you'll see us once a month. Sometimes it'll just be me. Other times we'll invite speakers in from the faculty from the Institute, and I'd like to bring some other people from the outside in as well, some like special guests. Those will be people both who are already part of our community and people who are from outside our community, kind of special speakers that only will be accessed through our community coaching calls here. If you haven't taken Annette's course, you can find it on the Institute website, Mindful Stress Management for the Healthcare Professional. It's there. It's a 6-week course. And in 3 months, in about March, maybe toward the end of March, there's going to be that smaller, briefer, but really, really powerful course that Annette's going to lead with 2 other colleagues of how to teach this to, let's say, a PT student who maybe you're supervising. Annette, do you want to talk about that just for a moment?
Yeah, the Mindful Clinical Mentoring course is really geared towards instructors in clinical settings. So if you are accepting students or postdocs or any type of, even volunteers, I think this would be a great course. It's taught in three to 4 modules. The 4th module is really a case study in which we unpack some challenging students. And it's a way that the clinical instructor can learn aspects of mindful presence, mindful teaching, and then the student can benefit from that teacher. So it's not just about one or the other, it's about the student-teacher dyad. And it's about the challenges of being a young person today in a very stressed out world. So there's some new data There's a lot of neuroscience in it. Nothing overwhelming, but really interesting stuff. So I hope you'll join us.
And it's only about 3 or 4 hours total. Is that right, Annette?
Yeah,
Right.
4
So
hours.
It's intentionally meant to be brief and, of course, applicable to using in practice. Although I think if you have children, teenagers, kids in college, friends who are, have challenges, all of it starts to become really, really useful. Just so you all know, the reason how this developed is a lot of PT programs are reaching out to Annette and they're saying, can you please come to our program and teach us this? Because we have stressed out PT students who are having challenges. And of course, we want them to graduate and be good PTs, and we need some help. So that's where this is all developing from. So Annette's doing some work where she's going into the PT school directly and educating the staff at the DPT program, as well as the clinical instructors in the field that are coming in and receiving this training as well. So you can just take it as an individual course if you want, but I'm going to talk to Annette about including this to be part of the psychologically informed certification, because I really think this is where, once you've embodied all this work, this is the course where you now take it and teach it to other people, right? And that's what I was saying before about the leadership aspect. I really do think that once you're able to teach this to other people, that's where kind of the magic starts to happen.
Yeah. And that's the intent of the course, really, is to have you leave feeling like you could lead a patient, a student, a volunteer, some young person through a brief meditation, body scan, or some other way of increasing mindfulness. Yeah, and PTA programs as well. Absolutely.
Good. Okay, more to come. Happy holidays to everyone.
Yeah.
Enjoy December and
Thanks
happy
for
New
all
Year.
you're doing.
Thank you too for being here,
You're
Annette.
awesome. You're amazing.
Come see us at CSM if you are in San Antonio, Texas. We'd love to meet you. If not, we'll see you in about a month on the next community coaching call. All right, everyone. Thank you so much. We'll see you soon.
Thank you for listening to the Healing Pain Podcast with Dr. Joe Tatta. To subscribe to the podcast and learn more, visit Integrative Pain Science Institute.com. That's Integrative Pain Science Institute.com. Sign up to receive weekly updates, leave a review on iTunes, and share this episode with your friends.